Remley, what is opioid use disorder?
Opioid use disorder, it has gone by a lot of names historically. We've outdated terms like drug abuse, opioid abuse, and now opioid use disorder is a disease. It's something that addiction has its hold, and we're starting to treat it like a medical disease that it is.
What is buprenorphine?
Buprenorphine is a medication for opioid use disorder. It is a treatment that helps people who are addicted to opioids displace their receptors and be able to function and live a normal life.
Why is it important for paramedics to understand opioid use disorder and the relationship between opioid use disorder and buprenorphine?
Because who is the first person that a person with opioid use disorder may encounter in the medical field? And sometimes the only person. Well, often that's us, whether we are EMTs or paramedics. We may be the only opportunity to intervene for that patient and offer help.
And what sort of resources are there out there? Are there any new resources that may have just come to light?
I am so glad you asked. As it turns out, Pre-Hospital Emergency Care has just published a special issue on enhancing care for patients with opioid use disorder, where I had the honor of serving as the guest editor. So this is 30 articles enhancing the knowledge that we have around treating patients with opioid use disorder.
And I think it's important for paramedics to actually avail themselves of this information. Listen, I get paramedics all the time that ask me about resources for learning cardiology. But here's the thing, is that a lot of those resources don't come in to be very helpful that often. Most of the time, your AFibs and your things like that, these are easily identifiable, your STEMIs and stuff like that. And it's your more obscure stuff that this deeper learning takes care of. You are going to take care of a lot more people suffering from opioid use disorder than you are with one-to-one A-flutter, where those resources were going to help you out. And so this is just as important, if not more important, than your cardiology resources, your neurological resources. Wouldn't you agree?
Absolutely. It's a place where, as EMS, we're often the first and only contact, and we have an opportunity to make a real difference.
Excellent. And so the link to these resources, where you can find them, I will put that in my bio or in the video description on Facebook.